Starting the webinar. Well, hello, everyone. My name is Krista Wheeler, and I'm a research project manager at Nationwide Children's Hospital in Columbus, Ohio. I'm also a co-chair for MPA's Child Injury Committee. I'm pleased to moderate what promises to be an interesting set of presentations on injury dashboards. I'd like to introduce you to our speakers. We have Ali Bianco. She's an injury epidemiologist at the Michigan Department of Health and Human Services, where she conducts surveillance and analysis for a variety of injury types. She also serves as the data committee lead for MIPA. Also today we have Lauren Fink, and she's an epidemiologist with the Oakland County Health and Human Services, where she leads cross-cutting projects at the intersection of data modernization, injury prevention, and public health equity. Her work includes developing interactive dashboards and analytic tools to make injury and violence data more accessible and actionable for program staff, partners, and the public. Lauren also coordinates the department's Data Stewardship Committee. Lauren Milroy is also here today, and she serves as a surveillance and evaluation director in the Division of Trauma and Injury Prevention at the Indiana Department of Health. Lauren joined the health department in 2015 and previously served as a tobacco epidemiologist and as a vaccine preventable disease epidemiologist before joining the Division of Trauma and Injury Prevention in 2024. We also are joined by Abigail DeSantis, and she's been the data visualization, she's been on the data visualization team lead with the Office of Data Analytics at the Indiana Department of Health since 2022. She's currently receiving her MPH in epidemiology at Purdue, and she previously attended the University of Kentucky for both an MPH and BS, and she previously worked for the Kentucky Department of Health. We're pleased to have the opportunity to learn from their experiences and expertise, and please feel free to ask questions in the session chat at any time. And we do hope to have time for questions at the end of their presentation. Thank you.
Hi, everyone. I'll be going first. I'm going to turn my video off because it's telling me that my network bandwidth is low. So if you cannot hear me at some point, just let me know. Hopefully we don't freeze. And let me share my screen here. All right. And let me know if you cannot see currently a web page should be showing up. And not hearing anything, so I think I'm good. But all right, hi everyone, my name's Ali. Again, I work at the Michigan Department of Health and Human Services as an injury epidemiologist. And today I'll be walking you through our new injury and violence data web pages and new dashboards that are accompanying them. We just released all of these last month, so very new and excited to share them with you guys. So what you should be looking at here is our injury and violence data webpage. Like I mentioned, this is a new web page that we just published that will be able to house our new data dashboards, our reports, and additional resources that link to injury data. Prior to this, we didn't really have an injury data hub on our MDHHS web pages. Different programs might have their own web pages or dashboards or reports kind of scattered around, but now with this, we're hoping it can kind of be a one-stop shop where people can come and find the injury data that they need, or at least links to kind of get them in the right direction. So what I'll be talking about mainly today is 3 of our new dashboards that we published. So you can see all of our available data dashboards here. One of these, our Michigan Violent Death Reporting System dashboard, had been published a few years ago, so we linked to that here. But these other 3 are all brand new and were developed at the same time, which I don't know if I'd necessarily recommend making 3 dashboards at once, but I think it worked out for the best. We built all of them in Tableau, and it was kind of a collaborative effort by different epidemiologists within our unit. So we had 3 different main epidemiologists working on these. Like I said, the cons were that, every issue was kind of magnified by 3, but the pros were that it was very collaborative, and I think it made the dashboards better because we were able to have that team working on them. So now I'll just kind of walk through a very brief demo of each of these dashboards so you can see what they are and how they work. And then I'll talk through a little bit of our design practices and what we tried to incorporate in all of these in order to make them cohesive and also usable by people. So what I'm showing you first is our Advancing Violence Epidemiology in Real Time, or AVERT Firearm Injury Dashboard. This dashboard was created using funds from our AVERT grant. And we published it with the hopes that we could provide more timely firearm data, which is a really big ask by a lot of members of our community and prevention partners. I'm sure if you work with data, you're aware of, everyone wants timely data. They want to know, what happened yesterday so that they can inform what's going on in their communities and kind of inform those prevention and programming efforts as well. So this dashboard was created in order to be able to provide that more timely firearm injury data. It uses near real-time emergency department data or syndromic data, if you're familiar with that. And we're looking at it for kind of a snapshot of the most recent 12 months. So it'll be updated on a quarterly basis and show, the most recent 12 months from there. You can look at it by trends over time, but also basic demographics here. And you can even kind of filter down to different regions within the state. So if you want to see what's happening in a specific region, that option's available as well. Next, I'll show you our non-fatal suicide dashboard. So similar to the AVERT one, this was also funded by a grant, the Comprehensive Suicide Prevention Program grant. And also similar to AVERT, it is using near real-time emergency department data or syndromic data with a focus on being able to show non-fatal suicide outcomes. So suicidal ideation, ED visits, and then also suicide attempt ED visits. And I will note too that the creator of this dashboard, so the epidemiologist who worked on it, did a lot of really collaborative effort and got a lot of feedback from partners interested in using this data. So she incorporated a lot of that in order to make it most useful to the people that really wanted this data. But again, you can see we're showing most recent 12 months of data, kind of looking at changes over that time frame, what groups are seeing the highest rates, again, presenting the data by demographic and even attempt methods, and showing it by different maps. And again, she used kind of that collaborative effort to determine what would be of most use to people using this data. So offering some different map types, for example. And then finally, the last dashboard that I will briefly demo is the one I made. So I will note that I know this one the best because this is the one I made, just an FYI, but this is our injury indicators dashboard. This dashboard is kind of a complement to the other dashboards in that it's offering more historic data and using kind of more of our traditional data sources that also have a little bit more lag on them. So you can see our most recent data available here is 2023. We should have that finalized 2024 data soon, but whereas with these other dashboards, you can look at data for say like a few months ago or last month, this one is probably better if you want to get those trends over time. So our hope is, if people are looking at firearm data or non-fatal suicide data, and maybe they want to look at that more in-depth data, they can come to this dashboard and get that information. So this dashboard is showing data by deaths, hospitalizations, and also emergency department visits. When you click between them, you can see that the pages look very similar. You can also look at different injury types. So again, if you wanted to look more in depth at firearm or suicide data for different years, you could do that. But we also offer injury types that aren't on other dashboards. For example, unintentional fall or drowning or traumatic brain injury. And again, you can look at that by demographics, counts over time, and then residents, like county of residence of the decedent or patient. And you can also look at it by, again, different timeframes or years of interest. So again, that's a very brief demo of these. I could probably demo them for the entire hour because there's a lot going on in these dashboards. But I'll put the link in the chat when I'm done. And I definitely encourage, if you're interested, please take a look at them and play around with them yourself and share them. We're very proud of how they turned out. But for the rest of the talk, I'll just kind of, go over some of the best practices we tried to incorporate across all of these dashboards. And, how we tried to keep them cohesive as we made 3 dashboards at once. So one of those things being, making all the dashboards uniform. You'll notice they all have a very similar look. They're using similar colors. For example, you look and they have the very similar colors for the different buttons when you've selected them. It'll show you what's selected. We also use similar, little like symbols throughout. So if you click here, you can get information on the dashboard. Same thing if you click on our Michigan Injury Indicators one, it has that same little question mark. We also wanted to kind of ensure that they were simple enough and easy to use that people could get the data that they need, but also like letting people who aren't as data or tech savvy be able to use these as well. So, a lot of people want all the data, all the stratifications, all the crosstabs, give me the rates and the confidence intervals. But then we also wanted to make sure that these dashboards could be useful by people who maybe just want to know what's going on in their community. Maybe they're not super data savvy, but they need some data for a grant that they're writing. So we had a lot of conversations on how to do that. One of the things that we talked about was just keeping things clean and simple. So in all of our layouts, We tried to keep things pretty clean, not put too much clutter, and also follow similar layouts across all the dashboards as well to keep them uniform. So you'll notice we try to put the parameters and filters on that left-hand side. We also try to make sure that everything's accessible from the same page. So for example, if you're looking at deaths here, you click away to hospitalizations, but then you want to, maybe look at deaths again. You don't have to try and remember where you navigated to it from. Should all be available on the same page for the most part. And that's something we tried to follow among all these different dashboards with different buttons. I'm sorry, my Zoom screen sharing is popping up. So that's another element we tried to incorporate as well, was keeping it clean, simple, and easy to navigate. We also tried to add interpretive statements where possible. So that's something that can be difficult with dashboards is interpretation, but we tried to, where we could, explain what people were looking at. So for example, if you hover over this number, it will show you just kind of a brief sentence of what this means. And I think this is something we'd like to add more in future updates, is helping people understand this data better. But for now, we put in a few elements like this as well. We also offered the option to download data. So on all of these dashboards, you'll see a download data option. We figured that when people are using it, they might want to take the data to, do their own analysis or make their own graph. So all of the data can also be filtered into these tables based on what you want, and you can download it to either an Excel or CSV file. And then another element that we all kind of include on our dashboards is a technical document. So you'll see this document for each of the dashboards, and they're pretty extensive. Like this document here is 16 pages just for one of the dashboards. And it goes into all the nitty gritty kind of behind the scenes, what's happening. So the data sources used, the methodology, what exactly we did to query the data, the codes we use, the limitations, etc. And sorry to scroll fast. Then at the bottom here, we even talk about, how did we calculate the rates in this dashboard? What does data suppression mean in this dashboard? What are our geographical categories? And also limitations. So what should we maybe take with a grain of salt from this dashboard? And this has been really helpful to have already when people have more complex questions on what's happening in the dashboards or why this says this or that. So we can point them to this document and kind of have those already written out. So again, that was kind of a brief overview of what we've been working on. I'll put the links in the chat for you guys to check them out yourselves. I think for now we're celebrating having these out, but we definitely do plan to continue updating them and working on improvements. We plan to evaluate them using surveys at some point. And also we're working on developing a dashboard best practices document for our Bureau so that we can continue to keep our dashboards uniform throughout the Bureau, but also hopefully help people avoid any snags that we ran into, and learn lessons learned as we went through this process. And just continue to kind of build up this webpage as a place where we can have our injury data and help people find the data that they need. So with that, I will stop sharing, and I think we'll take questions at the end. So thank you.
Awesome. Thanks, Allie. I think I am up next. So my name is Lauren Fink. As Chris already mentioned, a little bit about my background. So I'll be sharing a little bit more from the local health department perspective. And at the Oakland County Health Department where I work, we have a relatively small but mighty team of folks who build our data tools, and I'm really proud to talk about some of the work that we've been able to do around injury. I'll go ahead and share my screen here. I did not share my screen. Sorry about that. Now I'm going to share my screen. All right, let's see. All right. Does everybody see my slides over here? Okay, great. And then, okay, but you don't see my notes, is that right? I see a thumbs up. Okay, great. Thank you. Thank you, Abigail, for the thumbs up. So as I mentioned, I'm a generalist epidemiologist, which means that, I kind of do a little bit of everything. I cover all the topics that we don't have a dedicated epidemiologist for, but injury prevention is probably the closest one to my heart. I'll talk a little bit about why that is in a minute. But I'm especially proud of the medical examiner data dashboard project that I worked on with my colleagues. And excited to tell you guys about it. A little bit about Oakland County first. We're the largest public health jurisdiction in the state of Michigan, with a population of about 1.2 million. I didn't put a map on the screen, but Michiganders will appreciate me just letting you guys know we're right about there. If you can't see me, I was showing you on my mitten hand here. We've got a diverse population. It's sort of a microcosm of the state of Michigan, suburbs, dense urban areas, and about 6% of our population lives in a rural area. Um, so a little bit of background on this dashboard, and I'm sorry to do this, but I'm going to ask everyone to think back to 2020, and I promise we won't stay there for long. But anyway, so it's 2020, and many jurisdictions are rapidly standing up public dashboards to share information about COVID-19. Ours was among them. And all of a sudden, for the first time ever, we had residents visiting our website daily looking for up-to-date public health data. Fast forward to the late 2024, I received a request from our county executive office that they wanted to launch a new series of public dashboards that would replace the COVID-19 dashboards. They wanted to kind of continue engaging these residents who had become accustomed to coming to us for data. They wanted to expand and provide more information rather than, just focusing on COVID-19. So the idea was they wanted us to launch at least 3 dashboards in the new year, and we had about 3 months to do that. So I started by convening a small group of health department staff. I do not have a picture of all of the amazing people who were involved, but here are 2 of the colleagues that I worked with. So Cass Miarka from our medical examiner's office and Hannah Cassisi, one of our incredible health educators. We also had representatives from our communicable disease team, our planning and evaluation team, and other program staff. It was really important to me that we included the program staff from the beginning because they were really the primary end users of the data internally, and the ones who were most familiar with the external partners who would be interested in using this data as well. We held an initial meeting. We did some visioning and planning. We discussed topics like what type of data requests do we typically receive? What topics do people seem the most interested in? What types of data do we that we use regularly but is not available to the public? And we also considered data that's available to the public somewhere, but it's not in a friendly format, something that we might be able to make a little bit more friendly, a little bit more tailored to our particular audience. And we really had like kind of a broad like directive that we had received from leadership. They just wanted like information that residents are going to use. And it had to include something about respiratory disease somewhere. And so we decided to focus to our 3 dashboards on respiratory diseases, maternal and child health, and then a dashboard with our data from our medical examiner's office, with the 3 most requested topics. As Ali said, firearms absolutely among them, and then also suicide and overdose were the topics that our medical examiner most frequently received data requests about. So today I'll be walking us through our medical examiner dashboard, but I think it's worth mentioning this history about how it came about because as many of you know, it can sometimes be a challenge to bring public health leadership attention to prioritizing injury surveillance and data sharing on injury topics. And so I'm proud of how we were able to leverage leadership motivation around a different data sharing kind of topic or motivation, and then use that to show how injury data fit into that vision as well. And so myself and one of our communicable disease epidemiologists, Jared DeValentine, we spent the next few weeks working on prototypes. And at our next meeting, received feedback from the internal team. We had a really rich conversation, especially our health educators brought up things that I wouldn't have considered about like the layout of the page. And we ended up like deciding to put the medical examiner dashboard as the last dashboard on the page. Just one example of something that I just wouldn't have thought of, but they were concerned that people might come looking for respiratory disease data and kind of be confronted with fatality data that could be kind of intense. And so they decided that it would be best to put that one at the bottom of the page, just one of like all kinds of really great suggestions that they had about our layout. We took all of this feedback and worked on the next iteration of our prototype. Before I get into that, and I'll show you guys the actual dashboard, I also want to talk a little bit about how we like our workflow for the data. The dashboards are built in Power BI, and something that is important to know, especially if you're new to working in Power BI, is that there's pretty much no way to completely protect your data that's in the model, like once it's in Power BI. So we used R to clean and aggregate our data and make sure that anything that's going to be made public, the underlying data model, is completely compliant with our data release policies. We also have that same R script that produces the data for the dashboard also produces line lists, which are used only for internal dashboards, where we have more control over the sharing and making sure that data stays protected. So after integrating feedback from our internal teams, we shared the dashboard drafts with our county's web accessibility team. And I learned a ton in that meeting and came away with a very long to-do list and a much better understanding of all the different ways that people navigate the internet. I will be honest and say that accessibility is an ongoing challenge for us. We were able to integrate a lot of their feedback, but we want to do more than just meet minimum standards. We definitely still have a journey ahead of us to reach a standard that we'd like to meet with accessibility. But one thing that I was like surprised by was to learn that our county's color scheme is not colorblind accessible. And so they have a separate orange that is used for things that have to be colorblind accessible. I'm like, why don't we just change the county's orange? But that's not my job. So anyway, the website uses our color, or the dashboards use our colorblind accessible orange. Our final step before these went live was to conduct some user testing. So we created a survey in Qualtrics and a list of specific individuals that we wanted to request feedback from. We were aiming for quality over quantity. We started by brainstorming a list of stakeholder groups, and then we made sure that each was represented. So this included like academic partners, nonprofits, internal staff from certain programs who hadn't been involved in the planning stages, and like other peer jurisdictions. We ended up reaching out to 13 people. We were really lucky to have 100% response rate from the testers that we asked to complete our survey. And we were able to provide them with a prototype page and receive their feedback. Responses were largely positive. We did receive some really valuable constructive feedback that we were able to incorporate. And I just want to share one piece kind of while we have. So this is the landing page for the medical examiner dashboard. And one piece of feedback that really stuck with me and meant a lot to me from one of our testers was, although these dashboards display some very challenging and sobering health information, it's clear that the stats were handled with care, respect, and an understanding that these numbers represent the lives and experiences of our Oakland County friends and neighbors. And I just felt really proud reading that. It's something that's really important to us to, you know, respect the humanity of the people these numbers represent. So I will just very briefly, because I can also drop in the chat, and our goal is for these dashboards to be really like easy to navigate on your own. So I don't want to spend too much time walking through them with you. But I will switch my screen here. I'm going to end my share for just a minute. And now I'm going to share my screen again and pull up. So this is where you land. Can you guys see my screen here? When you first get to the, is my screen sharing? Oh, it's not. Okay. Try this again. I am so sorry. Okay. Now, can you see it? Awesome. All right. Thank you. This is the landing page for our data and statistics page. And then we've got these anchor buttons at the top. So like I said, we've got our medical examiners third on the list so that if you're scrolling, you won't kind of come to it immediately. We also have information on like how to interpret the data. Our leadership really wanted us to have something positive. And so we have this section called Improving Trends, which kind of talks about some of the work that we're doing to address these different issues. And then we have related resources available as well. We wanted this landing page to be really simple and just have some very straightforward information. And then more details are available as you click through the tab. So For firearms, we include information about manner of death. We have demographics for everything, for all of our topics and trends. We have for suicide, we have a breakdown by means, just trying to answer some of the most frequently requested questions that we get. We've disabled cross filtering, similar to what Ali said about just trying to keep things pretty simple and straightforward. Um, and then here is our page for our drug-related deaths, where again we provide information on manner of death, and whether fentanyl or synthetic opioids were involved. We have more detailed dashboards available internally for each of these topics, but we tried to keep our public dashboards really straightforward, and then people know how to reach us. We have an email address, health.data@oakgov.com. If people need more information, and we're happy to provide them with more detailed data that way. And then we have our data notes page, which is not as beautiful and detailed as the documentation that MDHHS has that's like goals for one of these days, but we try to at least make sure people have the information that they need. And that is what I have. Thank you all so much. I hope I didn't take too much extra time. I think I might have taken an extra minute, but I'll turn it over to Lauren and Abigail.
Great. Thanks so much, Lauren. Let me get my screen shared here. Okay. So thanks everyone again for joining. I'm Lauren Milroy. I'm the Surveillance and Evaluation Director for the Division of Trauma and Injury Prevention here at the Indiana Department of Health. And I'm also joined by Abigail DeSantis, our data visualization team lead in our Office of Data and Analytics, to talk through some of the injury dashboards our division has developed. So quick overview, I'll kind of talk about IDOH's centralized model for dashboard development, and then go into some additional information on 3 dashboards that we've launched in the last year. One that's a hospital level dashboard for our trauma data, an injury prevention dashboard, and then our violent death dashboard. So a lot of the model that we have within our health department in terms of dashboard development stemmed from a data transformation initiative that IDOH kicked off a few years ago, really looking at transforming how we analyze, visualize, and share data. And as a component of that, IDOH developed a centralized Office of Data and Analytics that really exists to support data analysis and visualization and data science needs across the agency. And within that office, we have a business intelligence team that supports dashboard development across divisions. So while divisions still retain their own epidemiology staff, they work closely in tandem with the Office of Data and Analytics when we're developing dashboards, just to make sure that they meet agency standards, and are consistent across program areas. And it's also been really helpful to have that technical expertise, because it helps to make it a lot more efficient to build a dashboard when you have kind of that expertise built in, and then the program area can advise on what they want to see on the dashboard, how the data should be presented, but have external partners to rely on that can help with that technical piece. So over the last year, our division launched 3 different dashboards related to a couple different initiatives we have. One was a hospital trauma dashboard to support the work that we do with our trauma registry in terms of sharing data back with submitting facilities. We also launched an injury indicators dashboard. This is related to Health First Indiana, which is an initiative that launched a few years ago, really aimed at strengthening public health infrastructure at the local level. So this is really intended to support the work that local health departments are doing around injury prevention. And then lastly, we also launched a violent death dashboard, which is part of our public health analytics and data storytelling initiative, agency-wide, which just looked at developing a number of dashboards to make our data more visible and accessible. So starting off with our hospital trauma dashboard, for Indiana, we require submission of data for trauma cases from all hospitals around the state to our state trauma registry. And previously, we had done a lot of reporting back to the hospitals, primarily via creation of static reports in SAS. These would be developed as PDFs that would then get emailed directly to hospitals, which really resulted in emailing over 100 reports every quarter to different facilities. So just not a very efficient approach, and also really limited how much we could provide back to hospitals, because it's just a little bit limiting to try to cram a bunch of information into a static report. So we really had wanted to convert this to a dashboard. But we ran into a couple of challenges, primarily because Indiana code does require that hospital level data needs to be kept confidential, so masked using some kind of code or other de-identification method, primarily because it can be pretty sensitive data, especially if you're looking at certain performance metrics. And also we want to, maintain that confidentiality for our hospital partners. However, there are certain methods that we've used for other projects in the past, for example, using like a code to de-identify the hospitals that just wouldn't really work for our trauma data because the case mix of certain hospitals is unique enough that it would de facto identify the hospital, even if it were masked using some kind of code or other de-identification methods. So, for example, a pediatric trauma center would become pretty readily apparent if you're just looking at the basic case mix of the patients from that facility. So the other issue is that we really couldn't support creating individual accounts for direct access to an internal dashboard. So the solution that was developed through our Office of Data Analytics was to provide hospitals a unique access code for the dashboard directly. And I will turn it over to Abigail to speak to that process for how that was developed.
Hi. So this was a really common ask that we were getting kind of in general, but like Lauren said, there were over 100 and they were pretty easily identifiable. So I don't want to get too in the weeds on like what we actually did on the Tableau side, but if you have any questions, you can always email me. So from what I can tell, we were kind of the first ones to implement this. Um, so we kind of developed this really scalable, secure, and just pretty simple solution to this where we assign each hospital a 6-digit alphanumeric code using a random code generator. For this, I just created a super basic data set with the facility name and the facility code where we joined in Tableau on that facility name. And then just created a facility code parameter where we made it a open text field so people couldn't even if this was discoverable by someone, you couldn't scroll through and just kind of click around and find different codes. You had to actually type in the code exactly as it is and hit enter to be able to view any of the data. This parameter is on the very first page of the dashboard that Lauren will display in a little bit. To be able to view anything, you have to have that entered correctly, and it just defaults to an empty IDOH code. And yeah, if you have any questions on how we actually did that, feel free to reach out to me, but I'll let Lauren go display that.
Yeah, so I'll switch gears here to a view of the dashboard. And I will say this is just a test dashboard. So it's not the actual dashboard page and it's not an actual facility. We just created an example for the purposes of this presentation. But this mirrors what a hospital would see if they were to access the dashboard. It defaults, as Abigail mentioned, to just a general IDOH code. And if you tab over to these other fields, sorry, it looks like it's refreshing just a bit. There is no data that's visible for that. So a hospital would enter their assigned code. This is just, again, an example code for demonstration purposes. But once they enter their code, they would be able to toggle over to the different tabs to see their data displayed. Again, as Abigail mentioned, it doesn't display the hospital, any identifying hospital information anywhere, but it does allow them to look at their aggregated data and query it a little bit more with a little bit more control over how they display the data and the time frame that they want to look at for their data. So we do have a bit of just descriptive statistics in kind of our demographics and injury and outcome tabs that gives them a snapshot of their case mix for whatever time frame they'd like to specify. It looks at an injury breakdown. So this example is showing injury by mechanism, but they can also filter by injury severity metrics or patient vital signs to look at, for example, high-risk trauma patients. And then a number of outcomes, so their ED or hospital disposition, ED length of stay, and things like that. So it's a pretty large dashboard, so I won't demo all of it. But the idea is to kind of give them back that aggregate data so that they can more quickly summarize it for their hospital level, especially for non-designated centers who might not have internal capacity to really be analyzing and looking at their trauma data. The other thing that we have on a few of our tabs for some of our key outcomes is a comparison over time for facilities data versus aggregate data for all hospitals that have the same trauma designation statewide. So this is an example of ED length of stay. It's one of kind of the key performance measures that we look at, where a hospital could look to see their own median ED length of stay compared to the median for hospitals with their same designation throughout the state. So the comparison bars would be those gray bars, and the blue and orange would be for the hospital-specific data. There's quite a bit of filtering that hospitals can apply, which is more than we'd probably put on a public-facing dashboard, but we kind of built this with the intent that the users really want to be able to get pretty granular looking at their data. So it just allows them to customize those filters. So for example, if they wanted to look at not just general ED length of stay, they could, for example, limit it to just their transferred patients. If they wanted to kind of subset their patients that way, or by demographic groups or certain types of injury characteristics. So that was one thing that we were really glad to launch. We did pilot it with a subset of our hospitals and got some pretty good feedback and suggestions for the visualizations. So it is something that we anticipate that will likely continue to refine as users get more familiar with it. But for us, it's just been a really helpful way to be able to get a large volume of data back out to our submitting hospitals without having to go through that process of manually emailing out reports every quarter. And then shifting gears away from our hospital dashboard, we do have a couple of public-facing dashboards that we launched within the last year. One is our trauma and injury prevention dashboard, and this is part of, again, our Health First Indiana initiative, which really focuses on strengthening public health at the local level in particular. So the intent of this was to make our injury data more visible and accessible for our local health departments. So this is also based primarily on kind of the standard injury indicators for ED visits, hospitalizations, and deaths. We have our state kind of key performance outcomes at the top, which we've defined these for different program areas as part of the Health First Indiana initiative. But then below is where counties or other public-facing external users can query the data a little bit more specifically. So can visualize it as counts versus rates, select whatever type of measure they would like to visualize, and then can select the specific type of injury as well. It is a little bit of a condensed layout just because we were trying to kind of fit things into a very similar template across different program areas for this Health First Indiana initiative. But I do think it still gives a pretty good range of access to the data. So within that, we can visualize trends, leading causes of injury, or toggle to a demographic breakdown if users would prefer to visualize the data that way. And then in addition to state level data, users can select a county and then filter to a particular county of residence that they would like to visualize the data for. So a little bit more limited in terms of filtering options. It is, like I said, a little more condensed to where the user does have to make some more selections to see the data that they're interested in. But in order to kind of fit it into this condensed space and still be able to allow access to a wide range of the data, this was the approach that we had taken. And then the last one that we also launched within the last couple of months is our violent death dashboard. This combines data from our vital records mortality data set with our violent death reporting system, but we've split that data out into separate tabs just to try to make that distinction a little more clear. So this first summary will just present overall counts and rates of violent deaths by manner of death and year over time. And then can be filtered also by county and to a specific range of time as well. We do also have a tab that breaks out our violent death data by demographics and also by means of death, which can also be filtered by the county level, years, or can be subsetted to a particular manner of death or means of death for users to kind of narrow down on the data based on those parameters. And then the remaining tabs are pulling from our violent death reporting system data. We do have some data notes as well in this final tab that explains some of the differences between the data sets. But in order to not be presenting, for example, demographics from two different data sets side by side, we limited our violent death reporting system data primarily to the circumstances data that we collect within that system. So for suicide deaths, we'll have suicide deaths by means, location, substances detected, and then death circumstances, which can also be filtered by year and by different demographic groups. We have a similar breakdown for homicide deaths and firearm deaths as well, where they can select by those different demographic parameters, and then also visualize some of that circumstance data. For now, the violent death reporting system data is just at the statewide, just because we don't have complete representation across all counties. I think we are exploring in future iterations how we could include some more local level data with the circumstances as well. But this first iteration is primarily statewide in focus. So with that, I think we have 5 minutes left. I will go ahead and wrap up, and we can see if there's any questions for our groups. Thank you all so much.
Yeah, if there's any questions, you guys can put them in the chat because that's the best way to relay those. I did want to ask about tracking metrics, and I don't know what do you see when, like, how often do you look at your metrics, and how do they inform what you do? And that could be for any of you guys. Any questions for any of you?
I can go first because my answer is pretty simple. Since we just published them, we haven't looked at them yet, but I think we do plan to look at them either, I believe it's monthly or quarterly, to help maybe inform some of our survey evaluation efforts as well. So looking at like views to those web pages and maybe noticing times of years, like, oh, we put out a press release, it's gone up, or oh, we presented here, it's gone up. So that's what we plan to do.
Yeah, I don't know if Lauren has access to view the metrics, but we normally look at those through our Office of Performance and Analytics. So I will let her know those eventually too.
Yeah, I was going to say, I think since our dashboards are kind of managed centrally, our Office of Data Analytics would have those metrics. We're in a very similar boat to Allie that our dashboards launched really quite recently. But I do think it's something that we will want to look at regularly and just kind of see what the use of those dashboards looks like.
Yeah, and on our end, that's something that our health education team kind of looks at for our whole website. I mean, as a county health department, we're a lot smaller and kind of more like I can literally see our health education team from here. And so they like let us know if they're seeing something. But typically that's something that they monitor. Although it's a really like this is something I might think about for next year is like maybe we'll schedule regular check-ins with them, maybe quarterly. Just to see if we're seeing any, increases at certain times of year or certain parts are getting more attention.
And I think somebody hit upon this, but like, how did you know all the compliance issues that you would run into ahead of time, or did they crop up as you went along?
I will say, no, we did not know of all the issues that we would encounter. And that's part of why we're making kind of a best practices like document for our bureau now. We also, any software you choose for dashboards, there's going to be issues, I think. And there's also this new ADA compliance rule that's coming out next April, at least for state governments. So we kind of already built our dashboards, and then that rule was passed, and we had to meet kind of a new standard. So we had to go back in, and that was a little hard, just kind of making sure it works on a dashboard that was already kind of built and then adding in some of these new features. So that was definitely something that we hopefully can let others know about so they avoid.
Yeah, and I guess maybe a similarly like technical difficulties that you'd want people to be like aware of, like what kind of things were you surprised that you ran into technology wise?
I can just say, so, this was our first project with Power BI. It was really like the first dashboard project of any type that we had built within the health department, because previously dashboards have been, we had one dashboard, the COVID one had been built by our GIS team for us. I think I, in retrospect, wish that I had thought more about like how much our updates are automated because there's little things that at the time it was like, okay, so you'll, refresh the data, run the R script, refresh the data, and then you just need to change these three text boxes. Um, and like that's so easy. Just change these three text boxes after you hit refresh. But it's surprising how much those little things can kind of like add up or delay like refreshes and with the data. And so I have been slowly working on making more of that automated, which can absolutely be done, but I just didn't have like that knowledge at the time. So there's a lot of ways you can save your future self or your colleagues' future time, but it takes more time when you're building.
Thanks, guys, for this really interesting presentation. It's always exciting to see a data dashboard and like be able to play around with the data yourself. And I'm sure people really appreciate the work that you guys have put into making these. So, thanks for talking to us about them. I think there's one more session left. But there's a break for 15 minutes. But thank you to everybody who joined this session. And thanks, guys, for this presentation.
I think, yeah.